Local leaders are concerned about coronavirus cases in high-density areas, including those behind bars. Across Massachusetts, there are 45 confirmed inmate cases. At least 3 inmates have died. More than a dozen staff members are also sick. CBS Boston's Anaridis Rodriguez has the story.
No consistent access to alcohol-based sanitizers, the access to chemicals, to clean cells and clean the units. It's scarce.
From his unit inside MCI Norfolk, inmate Ricky McGee sits in lockdown. The coronavirus hasn't hit the prison yet, but after 3 inmate deaths and more than 24 cases elsewhere, he fears it's only a matter of time.
The staff here who are issued masks, not all of them wear them.
30 miles north, his cousin Sir Paul Cottrell sits in his Dorchester apartment. New data reveals the neighborhood is among a cluster in Boston seeing the highest number of cases. Cottrell keeps busy by offering free online workouts to his neighbors.
People are extremely nervous living in this neighborhood, but at the same time, some people are just blind to what this really could do.
To see Dorchester, Hyde Park, Jamaica Plain, East Boston, our most vulnerable communities listed there really sounded the alarm for me in terms of what we need to do.
Councilwoman Julia Mejia says the city is working to address health disparities among communities of color who often live in close quarters and can't afford to stay home.
Most of the people who live in these neighborhoods are service providers. From the medical standpoint, what we've learned is that people who have high rates of asthma and diabetes, so people with compromised immune systems, and which usually are the people who live in our community. Black and brown communities, historically, we have always been the hardest hit, but we have an opportunity to really bond together and help support each other through this process.
I'm Anaridis Rodriguez, CBSN Boston.